How will you go for endotracheal intubation? For endotracheal intubation, guys, we need to keep the patient in which position? Sniffing morning air posture. Imagine you are giving general anesthesia to the patient. So you take the patient in a sniffing morning air posture. What is sniffing morning air posture? You give flexion at the cervical spine and extension at the atlanto-occipital joint. Very, very important. After you make the patient lie down in this position, now the pharyngeal axis and the laryngeal axis and the oral all are in the same line, and you can easily see the vocal cords when you intubate. So this is the position used. So just look over here, guys. I take the patient in a sniffing morning air posture, then I put the laryngoscope into the patient's mouth, right? And once I put the laryngoscope into the patient's mouth, I lift the tongue, and once I lift the tongue, epiglottis will be there. Epiglottis will also be lifted. Once I see the epiglottis lifted, I will see the vocal cords. Under vision, now I am passing the endotracheal tube into the vocal cords. Okay, that's regarding what, guys? That's regarding the endotracheal intubation. But this position is given when a patient is a slim or when a patient is a moderately built. But if the patient is heavily built, or if the patient is obese, you cannot take that position, guys. You have to take which position? You have to take a rammed up position. What is rammed up position? You keep many pillows or many stuff beneath the patient's shoulder so that his head is a bit elevated, so that his oral and pharyngeal axis comes in a single direction, and you can see the vocal cords once you put the laryngoscope. So this rammed up position is used in which patients? Obese patients, we use a rammed up position. So once you take the patient in a I told you, once you take the patient in a sniffing morning air posture, you take the laryngoscope. Now what are the types of laryngoscope, guys? Remember, we are having many laryngoscope, but commonly what we are using is a curved blade laryngoscope, which is called as Macintosh laryngoscope, which is commonly used in adults, and a straight blade laryngoscope, which is called as Miller's laryngoscope, which is commonly used in pediatrics. Why? Because pediatrics, these patients will be having a large epiglottis, which can be easily lifted through a Miller's laryngoscope. Now to this laryngoscope, now they have been very much ease given to this laryngoscope, so that you don't feel the difficulty of intubation. So what are the modifications that done to this laryngoscope? There is one modified laryngoscope which is called as McCoy's laryngoscope. You can see over here, McCoy is nothing but, to this laryngoscope handle they have added a small structure over here, which is basically helping you to lift the epiglottis as well as the tongue. That is McCoy laryngoscope.